give it to her whenever.
Can I see a warrant?
She can see the warrant when she gets arrested.
This is my house. I
Right.
have a right to see the warrant.
I'm letting you know she has a warrant for arrest.
Okay, so what is she under arrest for?
She's over 18. She's got to talk.
I understand that,
Right.
Detective Gonzalez.
Right.
What is she under arrest for?
She has a warrant for arrest. Okay?
For what?
This is Rosa Rodriguez, and she knows perfectly well why her daughter is being arrested.
I just asked you, baby, to tell me the truth.
Just a few months earlier, Alexee Trevizo had gone to the Artesia General Hospital emergency room, complaining of back pain. Roughly 2 hours later, Alexee went into a hospital bathroom where she secretly gave birth and disposed of her newborn in the trash.
And I just kept hearing paper towel dispenser and flushing and like the water running.
All I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
And so I started getting the trash out, and then when I did that, I seen that there was a baby in there.
After an autopsy determined the baby had taken breaths outside the womb, Alexee was charged with first-degree murder, and police arrived at the Trevizo home to make an arrest.
What is she under arrest for?
She has a warrant for arrest. Okay?
For what?
That's all I'm going to tell you. Okay?
What do you mean that's all you're going to tell me?
She's over the age of 18.
I understand that, but I have a right to know as well.
And we'll tell you that, but we
Okay,
we
then
need
let
the
me know
cooperation.
now.
We need the cooperation.
Let me know now. I'm giving you the cooperation. I told you everything. Answer my question. What is she under arrest for?
Like I said, she's over the age of 18. Like, that we can't relinquish that information. But if you bring her out here, we'll tell you.
What is she under arrest
If you bring her out here,
for?
we'll tell you right in front of you.
No, I'm not bringing her out here yet. Let me know what she's under
She's
arrest
gonna
for.
get arrested regardless, ma'am. I mean, I don't know why you're
For what? For what? For what?
Are you okay with telling me?
Yeah, go ahead.
Tell me.
Homicide. Open count of homicide. And tampering with evidence.
Tampering with evidence
Yes.
at the hospital?
Yes.
So, can we see her now?
Give me a minute.
Okay.
I have a right to see a warrant. It doesn't matter if she's over the age of 18. This is my house. You have a right. You have to show me that warrant.
If we are searching her house,
Even if she's under arrest, you have to show me the
it's
warrant.
up to her to show us.
Sarah, this is Rosa Rodriguez. Alexee Trevizo. Hey, I have the detectives here. They want to arrest my daughter. They're saying they have a warrant, but they can't show me a warrant for her arrest. Okay, thank you so much.
You good? When we get to over there, I'll give you a copy. She gets her copy. And then it's up to her.
Can I see the warrant?
It's an arrest warrant for her. It's
Okay,
not a
can I
search
see
warrant
the
for your
arrest
house.
warrant? I want to see the arrest warrant.
And what will that prove?
You bet when this is over, I'm coming for the police department and the hospital.
Yes.
I am.
Yes, ma'am.
You can arrest mom for obstruction.
No, we'll go there.
Please
That's
don't.
Sky Aguilar, repeated
Please
waiting.
don't.
She ran away from 1002 West
We actually, ma'am,
Washington.
it's nothing personal. It really isn't. And we understand. But we have to do our jobs too. Okay?
I understand that. I understand that.
Who's this?
That's Melanie. That's Devin's mom. She's good. She's okay.
We're not going to be rough with her or anything. We're just going to take her over there and book her.
Please don't be rough with her, please.
Just bring her out. You can be with her the entire time. Okay?
Do you know where the public safety complex is? 3300 West Main?
You can follow us over there. I will take you there. You can follow me over there.
As soon as I release the criminal complaint to her, she can then give it to you there, okay?
When can I get, like, her bond? What?
That's set up by the judge. It's Magistrate Judge Chuck
When-
Foster. He should be doing it, if it's after 3, he'll be doing it in the morning. Are you okay with your mother getting the criminal complaint? It has your personal identifying information on it. Serial number, date of birth.
Yes.
Are you okay?
Yes.
Okay. I have to serve you first, then your mom can get it, okay?
Okay.
I do. He's gonna move his unit around. No medications, anything you need to take while you're in there?
No, sir, no.
Okay. I'll be headed your way for the relay shortly.
We discovered a dead baby in the bathroom.
Oh my gosh. I'm sorry. It came out of me and I didn't know what to do.
Lexi, I told you about this.
But it
I
was
just asked you, baby, to tell me the truth.
scary. It was not crying or nothing.
What did you do to it?
Okay, stop right here.
I just
Stop,
put it
stop.
in-
Number one priority, guys. Number one priority is she just had a baby. I don't know if she's delivered the placenta. She's bleeding significantly.
Yeah.
I've spoken to the obstetrician at Loveless. They want her up there as soon as possible.
Okay.
I obviously need your permission to transfer her for medicals. She needs to
She's
be.
19.
Oh, you're right.
But she is a student too.
She's
No,
still
no,
19
you're
years
right.
old.
You're right. She needs to. I'm sorry, I forgot she's
A
19.
lot came out of me.
But you need to make sure that you're safe. I need to send you to Loveless to labor and delivery. Will you please agree to that?
Yes. Yes.
Okay,
Whatever.
great. I'm gonna work on that. In terms, I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And nothing was crying. It came out with nothing.
I know. But the baby's gonna have to be taken for autopsy and there'll be an investigator and everything. I'm really sorry, guys. I'm sorry. I'm so sorry. But we need to do this correctly. And I wanna be transparent with you about what our steps are gonna be.
Do you guys have, I'm the charge nurse here, do you guys have any questions for me?
Like, how big is the baby?
It's full term.
What?
Nothing,
9 months?
nothing was crying.
Lexi, have you watched the news of the girls that what they do to their babies and what they go to jail?
Nothing was crying.
Investigators then conducted interviews with all relevant personnel, ranging from nursing staff to hospital housekeeping.
I triaged the patient,
Okay.
Brought her to our triage room, asked her some of the intake questions, and then moved her to a treatment room. I probably started an IV, gave some medications.
Okay. Anything else?
What was her chief complaint?
Chief complaint, if I can remember. I think it was abdominal pain or flank pain, something like one of those two.
Do you remember what treatment room you moved her to?
Possibly two. I think it might have been room 2.
Okay.
Yeah.
Anything helps you remember that?
No, just looking at, kind of thinking of the layout of the ER.
Gotcha. So you triaged her from, did you bring her in from the waiting room?
Yeah.
Okay, so you brought her in from the waiting room, took her in the treatment room, and then, you triaged her, you just got her chief complaint, did vitals?
Chief complaint, vitals. I believe the doc came in and kind of did a quick assessment in the triage room before we moved her back to a treatment room. Then from there we gave her some pain medication. She started feeling a little better, and then she said she needed to go have a bowel movement, and that's kind of when the whole thing happened.
So what did you do after that? So when she went to do the bowel movement, where were you at?
Initially I was at the nurse's station, and then at some point I went and kind of checked on her, knocked on the door, seen if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Flush, toilet flush?
Yes, after a while I started hearing, so I probably checked on her 2 to 3 times, I'm not exactly sure. And then I just kept hearing paper towel dispenser and flushing and like the water running. And I knocked again, did she need anything? Denied anything. And then eventually it got to a point where I said, you need to come out. And I asked the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out.
Did she say anything at that point?
She didn't say anything. She was just looking kind of straight past me and went back to the room.
Did you look into the restroom?
I did.
Yeah. What did you see?
Went into the restroom and I saw a large amount of blood.
Where
and it was on the floor. It appeared to, like she had tried to wipe it up in places. It was kind of on the back wall behind the commode, the toilet. And so I said, you okay? What happened? And she said, I'm on my period, what she said. And she walked out. And then I went in, because at this point we had already received the positive pregnancy lab test.
When was that?
I couldn't tell you the exact time, but I know prior to that, we got a positive pregnancy test on her.
Okay, prior to the bowel movement, did you tell her that y'all got a positive?
No, the doc hadn't been in there to tell her yet.
Okay, so, okay.
Yeah, so went in there, and I did look into the trash can at that time to see if there had been anything tossed, but the liner was fresh and completely empty. I didn't pick up the can, obviously I would have known, but I just looked in the can and there was nothing in there. It was a fresh liner.
So there's no trash in the liner?
There was nothing in there, yeah.
Do you know if they keep fresh liners? Because I know some places they put
there's usually
new
like
liners
a roll
in the bottom of the trash can, and then they put the liner in and take the trash out.
Right, that way when they change it, they can just put a fresh one in. So there's usually a roll or a bunch of extra liners at the bottom of the trash can.
So you said there was blood on the floor, and it looked like some parts of it looked like it had been
Right, it looked like it had been wiped up.
Well, and you said on the wall. Was there any on the toilet?
I think there might have been some at the bottom of the toilet. I don't remember if there was some on the actual seat.
Okay.
No.
All right, and then so the doc hadn't told her that she had popped.
Not yet.
So because speaking with Vasquez, she said that, and don't quote me on this, but y'all did a urine and then a blood.
Right, so typically they'll do a urine and that just tells you negative, positive, and then they do the blood. It kind of gives them a range of how far along.
Did the urine come back after as well, or so did all of it come back after she came back?
It probably all came back before.
Okay.
Before the.
But the doctor would be the one to tell her.
Yeah, the doctor would be the one to go into the room and tell her. And after she came out of the restroom, that's when she went in to do a vaginal exam. Obviously, we didn't know what this blood was from. We were a little concerned that maybe she had known that we were going to figure it out and that she might have harmed herself or something in the restroom, so the doc wanted to go check her, but obviously that wasn't the case.
She had buzzed to go to the bathroom, so one of the nurses was going in there anyways because she was going to set up for them to do pap smear and everything. So she was like, I'll go ahead and disconnect her and she can go to the bathroom. So I was like, all right. So she was in the bathroom, and then Chris, which is one of our other nurses, he was like, because I was like, dang, she's flushing that toilet like an awful lot.
Oh, so you noticed her toilet
flushing? Yes. And then he was like, well, damn. So I went and I knocked on the door, and I said, are you okay? And she said, yes, I'm fine. I'm just having a hard time going to the bathroom, is what she replied. So I was like, okay. And then I was like, well, push the call light if you need anything.
So you told her to push the call light?
Yeah, if she needed anything. And then, a few more flushes had gone by, and then that's when Chris was like, I don't know, because I told him, what if she's having a miscarriage in there and, flushing stuff down the toilet? So he knocked on the door, and he's like, you gotta unlock this door. And then she wouldn't reply, and he's like, if you don't reply, he goes, and then that's when she heard him call for me. And he was like, Laura, you got the spare key to this bathroom? And I was like, yeah. Because we keep a ring of keys by the desk where I sit. So I went and I got the key, and just as we were getting ready to open the door, she opened it, and all I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
And you say everywhere, it was also on the floor too?
Yes.
Okay.
And then,
Now, was it covering the floor, or was it like
You could-
splotches?
you could tell she was wiping it up with paper towels because it was like smeared.
Okay.
Yeah. And then, the one that does have the footage of that, she's on vacation right now, is Erica, and she works in lab.
She took photos of it?
Before, because she was like, whoa, this is like,
Well, I didn't know that.
yes. And I didn't know that either till just recently.
And who is that? Erica?
Erica.
Compost or
No, let me give you her last name just a minute. I'm terrible with last names.
Oh, you're good.
But she does have the
Erica
video.
Salas.
Yes. She has the pictures.
Is she a lab tech?
Yes. And
Okay.
she's on vacation right now.
She's the one that's going to come next week.
On the 27th?
Yeah, or yeah, in 2 days.
Okay.
Sorry.
So and I did tell her not to erase that.
Good.
I said, do not erase that because that's evidence.
When did she find them? Or when did she tell you about them?
Like, I think it was like 2 weeks afterwards.
Oh, okay.
She had shown me the pictures, and then that's when I told her, do not, because I was like, dude, can you believe that? Like, because we had a patient that was pregnant at the time, just like after that, and I was like, on top of it. Just didn't want another recurrence.
Gotcha.
But yeah, so anyways, the floor was just smeared with blood, blood on the wall, like on the toilet and stuff, and
Do you remember which wall?
it was like the back wall between the toilet and the sink.
So, like, if you're looking at the toilet, like...
Yeah, like, say the toilet's right here where you're at, and then the sink's right here. It was, like, up this way, blood splatter.
What in...
Like...
In your line of work, what would cause that kind of splatter?
I think something that got pulled out or ripped. Like if you rip something and blood just went, it was like once you see the photo, you'll see what I'm talking about. It's just...
So, like you say, like, rip, like something went like that?
Yeah, like when you rip something, or if you cut something and you go, like you swing your hand and blood just splatters.
Okay, so...
That's how it looked.
Oh, okay.
Yeah.
I went in there and then I started cleaning. I started, first thing I did was I started mopping because we can't be walking around on that blood.
Okay.
So I started mopping, and then I started, after that I started wiping everything down. Then I went to the toilet, and I cleaned the toilet, and then I got everything, I had to do everything like twice because it was, bad. I wiped down the walls and everything, and after I did all that, I usually throw my trash first, but for some reason that night I had to clean the floor up and everything else. And when I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was trash in it, but I knew that didn't feel like when I picked it up it was some weight, so I thought it was the trash bags, because we put the trash bags on the bottom. And so I started getting the trash out, and then when I did that, I seen that there was a baby in there. And that's when I freaked out, and I called Lori and HT, or the nurses up front, and because there was a baby in the trash. And the baby, when I looked at it, the baby was wrapped up like in a, like in the bottom of the trash can, and with trash on top of it, in a trash bag.
And so how did you see it, like, as soon as you picked it up?
No, after I picked up the trash bag that was on top,
Okay,
where
so
they were throwing the trash at, when I picked that up to change it, that's when I noticed that there was, when I seen the baby.
Okay, so you lifted the liner and then saw
Yeah.
baby, okay. And I know it bugs you, but can you, like, describe the baby?
Yeah, he was about like that big. He had hair, and he was like purplish, but still not like pink. I don't know how to describe it. He was like, he wasn't bruised or nothing like that, and he was like purple, pink skin type color.
Okay.
How was the bag? How was the bag placed, or what?
It looks like she wrapped it around like that, and then wrapped it like under him, and then put him on the bottom of it.
Okay. And was the baby moving at all?
No.
Okay. Did you touch him at all?
No.
Okay. And so you said you called HT and Lori?
Yes.
Okay, what happened? What did you see after that? What did you do?
Okay, when all that happened, I moved the trash can. I told them that there was a baby in the trash. I could barely talk at that moment, and so then they took over, and I left. I mean, I went up to the nurse's station, and then they called the doctor and everything and all that stuff.
And all of these details matter because there has still been no conviction. As prosecutors pursue a murder case against Alexee, her family is suing the hospital for wrongful death, as critical evidence has been ruled inadmissible under doctor-patient privilege.